We also have a special date coming up on Friday, and that's going to be the end of open enrollment for Medicare. And Fidelis Care offers quality, affordable health coverage for children and adults of all ages. When U.S. citizens attain the age of 65, they qualify for Medicare. And this morning, Jennifer Lyons is back, the Director of Marketing at Fidelis Care, is here to help tell us how they can help you. So good morning, nice to have you here.
Thanks for having us back, Linda.
That deadline is coming up.
That's right, just around the corner. Friday's the big day, last day for the annual enrollment period. So last day for individuals to choose their Medicare Advantage plans for 2019.
All right, talk about Fidelis Care and why you're a very good choice.
Well, Fidelis Care is a mission-driven organization, and we were founded over 20 years ago on the fact that all New Yorkers should have access to quality, affordable health coverage. When we don't have health insurance, we might not be getting that very important preventative care that may bring on indications or let us know about more serious health risks that we may be facing.
And you have a kind of a grassroots approach to reaching the uninsured.
That's right. We want to make it as easy as possible for people to learn more about the programs that Fidelis offers. So we have representatives in every community that we serve, and we serve over 1.7 million members across all 62 counties of New York State. So regardless of where you are, we have help that can get to you. We have representatives that work very closely with local doctors and hospitals and community organizations to get to people who are uninsured.
Jennifer, who is eligible for your Fidelis Care products?
Well,
for Medicare,
for Medicare. So individuals, like you said, once they turn 65, they become eligible. Some individuals become eligible before age 65 if they have a certain illness or disability that may qualify them. And they have to be eligible or entitled for Medicare Part A, already enrolled in Medicare Part B, and live in our service area.
And people do need to understand that there are 4 parts of Medicare. So it's the kind of thing that you want to come in and speak with a representative and go through it part by part.
That's right. There's Medicare Part A, which is your hospital coverage. Part B is your medical. And then Part C is this Medicare Advantage plan that will take on the responsibilities for your coverage. So you have one card to present regardless of where you're going.
If someone is already working with you, Fidelis Care, and they're very happy with their coverage, do they need to come in once again before that enrollment period is up to have anything looked at?
Not necessarily, but I always recommend that you just give us a call, see if there's been any changes. You should be notified each year of any changes that are taking place to your plan, and think back on the year too. Did your plan work well for you? Or did you have where you maybe wanted lower co-pays? So this is your time to shop around, but certainly if you are doing well with what you have, you can keep.
And you know, nobody can really see into the future. So try to anticipate. This wasn't a problem for me this year, but you know what? I'm going to check into this because next year's a different story.
That's right. And there's plans that can really meet your needs, your medical needs, your budget. So it's worth the time to sit down with an expert. I always recommend that you bring a trusted friend or family member with you as well.
Absolutely. And Jennifer, people can come in from anywhere because you are everywhere.
That's right. In addition to all these community locations, that the partners that we work with, we also open an office right in Lafayette Square, downtown Buffalo. It's 403 Main Street. So stop in anytime. We have representatives there that can help.
All right, everybody. Fidelis Care. Remember, open enrollment ends on December 7th. For your medical questions, call them toll-free or feel free to log on to fideliscare.org.